Nortal is a global digital transformation powerhouse of 1,000 experts in the US, Europe and the Middle East. Known for being one of the main architects behind Estonia's transformation into a globally renowned digital society, Nortal's vision is to create a seamless society where all communications, transactions and services are effortless, leaving time for things that truly matter. We work with leading governments, healthcare institutions and businesses around the world, helping them simplify and optimize complex processes to tackle the challenges of today and build the future together.
Good morning, everyone. I'm very excited that so many of you have joined us. And of course, thank you very much to our President, Mr. Toomas Hendrik Ilves, for the inspiration. I hope that during this session today, you will also find actionable inspiration so that you're really able to take the next step in digitalization. My name is Taavi Einaste. I'm from Nortal. Nortal is headquartered in Estonia but operates globally. And we are a company that has really grown up building and breeding the most digitally advanced society in the world, the Estonian digital ecosystem. There's one principle that we use across all of the different domains that we work in, and this is we only design and implement systems which are user-centric. I think this is a principle that is especially important in healthcare, be it patients, medical workers, or other specialists who work in the healthcare sector. And then COVID hit. I think for all of us, the one thing in common from January, February, March last year was that we didn't really know what's going to happen. And once the news and hard facts started rolling in, it became clear that this is a systemic challenge. It's a pandemic for all of us, especially the healthcare sector. In this time of crisis, everything gets tested, and so did the Estonian digital healthcare ecosystem. You have to be able to flexibly change, you have to be able to scale up, and you have to be able to support the most important, support the doctors and support the patients. I will use a very simple example to show you how the Estonian digital healthcare ecosystem that we have built up over the last 20 years was able to support us. As soon as mass testing became available, we were able to use the existing digital infrastructure so that people, both patients and doctors, were able to book testing times online, get their tests, and also get the test results in a secure way so that only they can see it. What's more important during this time of crisis was that the same platform was able to collect those test results and present the data to decision makers near real time. So both for operational and political decision making, the decision makers in Estonia had very high quality data. But not only have we been using what has been built before. For example, we also built a secure platform for sharing COVID-19 test and vaccination data called SimplyGo. So that's something that we really had to come up with in a couple of months. I hope that some of this was useful for you. We have over 20 years of experience. We also operate in the US, so we know a little bit about this market. So please get in touch, and we are happy to support you in your next steps in digital healthcare development. Thank you.
Thank you so much, Taavi, for introducing your company and what you have been doing there. You said when you finished your keynote as well here that you have been experiencing also something already in the US.
Sure.
You have done something. Maybe you can just give us a couple of comparisons, like it's when you would have to compare building solutions like in Estonia here and in the US. What has been the biggest, I would say, challenges and differences when it comes to the implementation process?
Well, our clients in the US are mostly Fortune 500 companies. Mm-hmm. And with this, of course, scale is very important. So we have customers that have to service tens of millions, if not hundreds of millions of customers per day. So that really has a slightly different scale if we talk about the Estonian 1.3 million people. So I think for us, having worked in the US, the scale has been perhaps one of the most interesting things to learn about.
All right. But do you think that this is still like, as we discussed also with the president before, like, is it compulsory to have an electronic identity when it comes to accessing medical data? Or what could be the alternative there? Like, how can we access data if there is no national or
Sure.
like?
Well, I think from the president's message, the key here is to have a secure identity. Mm-hmm. And there are different ways of achieving this, and we see already also, let's say, private companies offering different digital identity solutions that you can also use in the healthcare space. So I think this is one. And I think overall, our approach always has been that when we do implement solutions outside of Estonia, it's usually what we call inspired by Estonia. It's not usually exactly the same thing.
I have experienced that a lot, that if you travel to somewhere that they would just bring it up like we would like to be like Estonia or do things like you do here. So definitely that's a very good point here.